EKG Technician. Description: the electrocardiograph technician program provides an overview of basic cardiovascular terminology, anatomy, and physiology, focuses on the proper placement of electrocardiogram, EKG leads, and maintenance of equipment to obtain an accurate 12-lead EKG. Learn to recognize cardiac arrhythmias. The course teaches responsibilities of ECG, EKG technicians, and provides clinical laboratory opportunity to develop entry-level skills. Course prerequisites: none. Nature of the EKG technician work. Cardiovascular technicians who obtain EKGs are known as electrocardiograph or EKG technicians. To take a basic EKG which traces electrical impulses transmitted by the heart, technicians attach electrodes to the patient's chest, arms, and legs, and then manipulate switches on the EKG machine to obtain a reading. A printout is made for interpretation by the physician. This test is done before most kinds of surgery, or as part of a routine physical examination, especially for persons who have reached middle age or who have a history of cardiovascular problems. EKG technicians with advanced training perform Holter monitor and stress testing. For Holter monitoring, technicians place electrodes on the patient's chest and attach a portable EKG monitor to the patient's belt. Following 24 or more hours of normal activity by the patient, the technician removes a tape from the monitor and places it in a scanner. After checking the quality of the recorded impulses on the electronic screen, the technician usually prints the information from the tape so that a physician can interpret it later. Physicians use the output from the scanner to diagnose heart ailments, such as heart rhythm abnormalities or problems with pacemakers. For a treadmill stress test, EKG technicians document the patient's medical history, explain the procedure, connect the patient to an EKG monitor, and obtain a baseline reading and resting blood pressure. Next, they monitor the heart's performance while the patient is walking on a treadmill, gradually increasing the treadmill speed to observe the effects of increased exertion. Like vascular technologists and cardiac sonographers, cardiographic technicians who perform EKG, Holter monitor, and stress tests are known as non-invasive technicians. Some EKG technicians schedule appointments, type doctor's interpretations, maintain patient files, and care for equipment. Working conditions. EKG technicians generally work a 5-day, 40-hour week that includes weekends. Those in catheterization labs tend to work longer hours and may work evenings. They also may be on call during the night and on weekends. EKG technicians spend a lot of time walking and standing. Those who work in catheterization labs may face stressful working conditions because they are in close contact with patients with serious heart ailments. Some patients, for example, may encounter complications from time to time that have life or death implications. Employment. About 3 out of 4 jobs are in hospitals, primarily in cardiology departments. The remaining jobs are mostly in offices of physicians, including cardiologists, or in medical and diagnostic laboratories, including diagnostic imaging centers. Training, other qualifications, and advancement. For basic EKGs, Holter monitoring, and stress testing, few-month certification programs exist, but most EKG technicians are still trained on the job by an EKG supervisor or a cardiologist. On-the-job training usually lasts about 8 to 16 weeks. Most employers prefer to train people already in the healthcare field. Nursing aides, for example. EKG technicians usually undergo a minimum of 60-hour training. They may be working part-time to gain experience and make contact with employers. EKG technicians must be reliable, have a mechanical aptitude, and be able to follow detailed instructions. A pleasant, relaxed manner for putting patients at ease is an asset. The following topics are covered in the EKG technician curriculum. Fundamentals of medical assisting. This is an introductory course for the medical assistance program. The course places emphasis on patient-centered assessment, examination, intervention, and treatment as directed by a physician. It includes vital signs, collection and documentation of patient information, asepsis, minor surgical procedures, and other treatment appropriate for the medical office. Medical office procedures and customer service will be discussed. Administrative and clinical competencies are presented. Students will be required to demonstrate proficiency in these skills: medical anatomy and physiology. The course is a study of human anatomy and physiology. Lectures systematically take the student from the microscopic level through the formation of organ systems, with emphasis on the interdependence of these systems. Functional concepts and internal structures are related to surface anatomy as a basic for performing a physical examination. The physiology lectures will provide the overall physiology of the human body, but will also relate how that physiology breaks down or malfunctions in time of infection, disease, trauma, and aging. Medical terminology. This course is a study of medical assistance of a medical vocabulary system. It includes structure, recognition, analysis, definition, spelling, pronunciation, and combinations of medical terms from prefixes, suffixes, roots, and combining forms. Medical law and ethics. This is a course of instruction in principles, procedures, and regulations involving legal and ethical relationships among physicians, patients, and medical assistants. It includes current ethical issues as they relate to the practice of medicine and conformity responsibilities. This is a writing-intensive course. Asepsis and infection control. This course is a study of standard protocol for the protection of the healthcare worker and patient to ensure that the procedures and treatments prescribed by the physician are performed properly and safely to assist the patient's return to health. CPR and first aid. This course will cover the theory and practical skills of the standard first aid course prescribed by the American Red Cross, American Heart Association, or other recognized bodies. The function of this course will provide a general understanding of the needs of the injured person, and in doing so, give care to the person including CPR until medical help is obtained. Introduction to EKG. This course introduces students to patient preparation, EKG machines, performing and mounting of 12-lead, single-channel EKG tracings, review of the cardiovascular system, and related terminology. Emphasis on basic rhythm identification and possible disease states. Applied EKG. Advanced knowledge of the cardiovascular system with emphasis on the heart in disease states, including identification of cardiac arrhythmias using EKG waveform, interpretation of advanced arrhythmias, hypertrophies, cardiac ischemia, and myocardial infarction is discussed. Clinical EKG. This course provides advanced training which is often required to obtain employment in the field. Cardiac stress testing, artificial pacemaker evaluation, 24-hour Holter monitoring, and advanced cardiac arrhythmia recognition and telemetry monitoring. Students use equipment which includes the pacemaker simulator, Holter monitor recorders, 3-channel EKG recording systems, and telemetry monitors. HIPAA compliance. This is a short course of study that discusses the patient's right to privacy, the laws and regulations of the Health Insurance Portability and Accountability Act, HIPAA, the governing bodies that set the standards and penalties provided for non-compliance are also discussed. Externship. Students are placed in a medical facility where there is an opportunity to observe, assist, learn, and perform patient services in an acute care setting. The externship is an essential component of the program, where theoretical and practical skills are integrated. Specific objectives, including cognitive, affective, and psychomotor behaviors, must be met for students to complete this course. Career development. This course is designed to assist the student in resume development, soft skills, intervening strategies, and decision-making skills to assist the student in obtaining employment. Optional externships are encouraged to offer the student the opportunity for real-life experience. Certification exam. I would recommend certifying through the National Healthcare Association. In order to become nationally certified as an EKG technician, You will have to achieve a passing score of 70% or better on the certification exam and prove competency performing an electrocardiogram. When preparing for your EKG certification exam, I would recommend my EKG test preparation book. Check www.bestamericanhealthed.com/resources.html. If you are training in a school that follows the National Healthcare Association curriculum for EKG, at the end of the module, the student will demonstrate knowledge of the anatomy and physiology of the cardiovascular system. The student will demonstrate knowledge of medical terminology related to EKG. The student will be able to identify the phases of the cardiac cycle. The student will demonstrate basic understanding of EKG interpretations. The student will demonstrate the ability to recognize normal and abnormal EKGs. The student will become familiar with different ECG equipment. The student will be able to properly set up ECG equipment. The student will learn proper identification techniques of the patient. The student will learn how to introduce him or herself in a professional manner. The student will be familiar with the patient's Bill of Rights. The student will list the important information that must be included on the ECG report. The student will demonstrate basic understanding of cardiac disorders and emergencies. The student will have a basic understanding of the pharmacology of drugs commonly used in the treatment of cardiac disorders. The student will demonstrate proficiency in cardiopulmonary resuscitation. The student will demonstrate proficiency in electrocardiography, ECGs. The student will demonstrate understanding of the theory of EKG by scoring a minimum of 70% on the National Certification Written Exam. Best American Healthcare University offers online EKG technician programs. See www.bestamericanhealthcareuni.com or www.bestamericanhealthed.com/online-ekg.html.